Hey everyone, Paget here, and today I'm going to talk to you about chronic pain, stress, gut health, and food. We all know how pain works, right? We injure an area and the nerves there get irritated and send a signal to the brain, which we interpret as pain. That's true in its most basic form, but does this apply in all situations? The answer is no. So let's think about this. The most extreme example would be that of a phantom limb. This is where someone is missing a limb, something like this, but they can still feel itching or pain in it even though they don't have that limb any longer. Now it's obvious that there is no injury affecting that area, but the part of the brain that was ordinarily to receive information from that missing limb can become oversensitized and tell the person false information. Now, when someone contacts me and says they've had back pain for years, they frequently tell me the pain is coming from something like a disc bulge or arthritis. And that's because they've had an X-ray or MRI that tells them that they have this, and the doctor has said perhaps they could benefit from surgery. Now, surgery does change the structure, and it can help in the case of disc prolapses. However, the doctors are applying the simple understanding of how pain works. For example, that's injury to the tissues equals pain. And this is often reaffirmed by that X-ray or MRI, telling the person, the doctor, there's something structurally wrong. But when we look at the general population, we find things like disc bulges and degenerative disc disease are actually common in people without any pain. According to a study in 2015 in the American Journal of Neuroradiology, they showed that the prevalence of disc bulges in people without any problems can be 20% in young adults and over 75% in people over 70 years of age. So this begs the question, why do some people have this pain and others don't? Another way of asking the question is, why is this person's brain not able to adapt to their current situation? That's relevant for the person with a phantom limb pain. Now, scientists and clinicians like myself have started to answer this question in a more holistic way and less myopic way. For example, we now know that stress can play a role in how we feel pain. Short-term stress on our bodies, minds, and spirits can be a good thing, and we have evolved to adapt and even thrive with that. The Mayo Clinic describes this natural stress response very well. They say, when you encounter a perceived threat, such as a large dog barking at you during your morning walk, your hypothalamus, a tiny region of your brain's base, sets an alarm system in your body. Through a combination of nerve and hormonal signals, this system prompts your adrenal glands, located at the top of your kidneys, to release a surge of hormones, including adrenaline and cortisol. The adrenaline increases your heart rate, elevates your blood pressure, and boosts energy supplies. Cortisol, the primary stress hormone, increases sugars in the bloodstream and enhances your brain's use of glucose and increases the availability of substances that repair tissues. This is all getting you ready to run away. Now, one of the immune system responses, this cortisol, also suppresses inflammation. The theory is that if you are bitten by the dog, you don't want to bleed too much because you might have to run away first. However, our body cannot tell the difference between the acute stress of a dog jumping out of us on that morning walk and the everyday stress of driving in rush hour traffic or commuting on public transport. Therefore, it releases these stress hormones every day, and over time, this can lead to many varied health conditions, such as anxiety, depression, digestive problems, headaches, heart disease, sleep problems, weight gain, memory and concentration problems, inflammation, and here's the kicker, chronic pain. So our body's reaction to stress can cause chronic pain. But what else causes pain in the body? Now, I talk a lot with my clients about sensitization. You may have heard of the term neuroplasticity, and this is essentially the way the brain can adapt to new stimuli and recover from injury. This process is also at work in chronic pain. If the brain has increased nociceptive input, aka pain, caused by things like injury and inflammation, it can change how it perceives pain, and it can become hypersensitive or sensitization to the signals from that area. For example, have you ever noticed how that if you hurt an area, let's say my elbow here, you don't want anyone near it or they don't want to touch it? Now, if they did, it's unlikely that they could actually make the injury worse, but your nervous system is on high alert, making sure that any sort of touch or movement is felt as pain. So how can we start to change that? And one way is to influence our neurotransmitters. These are amino acids that help our nerves literally communicate with each other. They can be seen as excitatory, meaning that they cause inflammation, or inhibitory, meaning that they are anti-inflammatory. Neurotransmitters can be made by the body, but also they can be made from the amino acids we eat in our food. Two notable ones when it comes to pain modulation are the excitatory amino acids glutamate and the inhibitory one, glycine. Too much glutamate and pain can be increased. By contrast, increasing glycine can decrease inflammation. And the body produces glycine naturally when you eat foods like meat, fish, eggs, dairy, and legumes. Now, another way to help reduce inflammation in the body and decrease pain is by paying attention to our gut health. A well-functioning digestive system with good gut bacteria can be essential for the maintenance of health, including energy regulation, gut barrier integrity, protection from pathogens, brain development, and immune system function. By contrast, if your gut bacteria aren't in tune with your body, something which is called dysbiosis, it can lead to metabolic disease, type 2 diabetes, obesity, cardiovascular disease, neurological problems like Alzheimer's and Parkinson's, depression, and chronic pain. This dysbiosis can happen when we are under stress and not eating healthily. Interestingly, many of the cellular receptors for amino acids are the same in the gut as they are in the nervous system. This has been described as the gut-brain axis. And because some of these amino acids can promote inflammation in the nerves, so if the gut is not functioning properly, it can lead to this neural inflammation in the brain and spinal cord and increasing in pain. So what can you do about it? Well, the first thing to do is manage your stress. Now, stress is unlikely to go away, but you can actually influence your reaction to it. So meditation, for example, would be a great place to start. Personally, I struggle with regular meditation, so I use a practice called the Wim Hof method, which is a breathing practice, and I combine that with immersion into cold water. The idea is that the immersion in cold water causes stress, and I regulate that with my breathing. So it's actually a practice that I can work on, much like an exercise, and it helps me manage stressful situations in the rest of my life. But you can also look at what you eat. It's important to have a sufficient intake of these amino acids. This can be very difficult for many vegetarians and vegans to get, and most don't realize that during times of mental or physical stress, the requirements for amino acids go up. I've treated so many vegetarians that experience this cascade of injuries such as tendon problems, muscle tears, and joint pain that they don't think are related to one another. For example, when I assess someone with a tear in their calf, a rotator cuff problem, back pain problem, and poor digestion, rather than treating each one of those things separately, I actually ask myself, how can I link them all together? And it usually comes down to diet. Now, a short change in their diet or supplementation is usually enough to increase their amino acids and collagen and break that inflammatory cycle and start that healing response. Now, in addition to this, a sufficient intake of fats are important for the anti-inflammatory pathways in the nervous system. Omega oils are especially important here, and they're found in oily fish and grass-raised beef, flaxseed oils, and especially the omega-3 type oil, which is actually not really present in many Western diets. So along with that, you want to eat foods that can help your microbiome. So that is going to be vegetables and potentially prebiotics or probiotics as supplementation if you need to. But I've commonly said you can't eat your way out of bad sleep. So you also want to look at your sleep as well. And one way to do that is to promote good sleep habits. So no TV or blue light after dark, or if you do, have to have some screens on, wear the blue light blocking glasses, avoid caffeine, and generally get a good rhythm. However, what you can do here is Google good sleep practices, and there is a ton of information out there which can really help you. If you follow these practices for stress management, anti-inflammatory nutrition, and sleep, you'll be giving your body the best chance to decrease the drivers of pain and inflammation, which will not only increase your general health, but also decrease your pain. And for people with back pain, this whole body approach is key. If you like what you've seen and heard here today, don't forget to like and subscribe to my channel. And share this with anyone who you think needs to know more about chronic pain, stress, gut health, and food.